Good morning. My name is Curtis Wallace. I'm a surgical technologist here at Rush University. I started my career in the United States Air Force. From the Air Force, I came to Rush University and have been here ever since. This morning, we will be going over video module number 1, hand scrubbing. Surgical scrubbing is the removal of as many bacteria as possible by way of mechanical washing and chemical disinfection of the hands and arms before any member participates in a surgical procedure. Surgical scrubbing helps prevent the infection and contamination of the operative wound by removing these bacteria from the arms and hands. It is estimated that 1.5 million nosocomial infections occur in hospitals throughout the United States. Wash hands and arms thoroughly with antimicrobial soap to a point 2 inches above the elbow. Afterwards, rinse hands and arms, allowing water to drip from the elbows.
Alright.
Open and remove sterile brush and nail cleaner. Afterwards, discard the package. Hold brush in palm of one hand and clean nails with nail cleaner. Press white button, which will allow the water to stay on for 10 minutes.
Yeah.
Moisten sponge with approved antimicrobial scrub agent to plain brush and begin scrub procedure. Hold nails perpendicular to brush and scrub. Now Paul will perform the stroke method. You can also perform the timing method. Finger, hand, forearm will be divided into a plane. And Paul will stroke each plane 20 times. Now it is time for Paul to rinse off. And he's putting his hands, one arm, hand and arm under the water, and he's letting gravity pull the water down. He's not going back and forth. Letting gravity pull the water down, rinsing himself off. A word of caution, rinse yourself off very well.
Go.
After thoroughly rinsing the soap from the hands and arms, Paul will now enter the surgical suite backwards. And Paul will demonstrate how to dry his hands off and put the gown and glove on. Notice how Paul, when he opened up his gown, that he did not place the gloves on top of the towel, so there's easy access to the towel. Now Paul is drying each finger. From the fingers, he will dry his forearm. He will bend over so the towel doesn't touch his shirt, and it will dry itself off 2 inches above the elbow. And he would take the opposite side of the towel, which is dry, and he would dry his other fingers, hands, forearm, 2 inches above the elbow. Paul will pick the gown up. There's 2 slits on each side. He will slide his hands through. He will look around, make sure he doesn't contaminate anything. He will slide one arm through and the other arm through. His gloves on. Notice his hands are not coming through the cuffs. He will start with the right one. His thumb down, fingers toward the wrist. He pinches each little end. He pulls over. As he's pulling over, he's pushing his hand through. Okay, now he will do the left side. Same idea. Thumb down, fingers toward the wrist. Pull over and push through it. Push the hand through. That's one. Complete the last part of gowning and gloving. Paul would have to turn. You notice how he breaks the piece of cardboard from the string. He gives me the cardboard. I hold it slightly. And he will turn slowly. And he will pull it away from me. This part being contaminated and that part still being sterile. Once again, the gown is only sterile from the nipple line to the waist. This module is primarily designed for new nurses, new surgical techs, and the medical students at Rush University. Just remember, the patient is always in good hands if you use proper techniques when scrubbing, gowning, and gloving. Thank you.